Reverse sugar Tong splint is ideal for splinting fractures of the radius, ulna, or wrist. It prevents flexion and extension at the wrist, limits flexion and extension at the elbow, and prevents supination and pronation. This video will show you how to apply Smile Splint, whose paddings can be opened and recovered thanks to its unique structure. You can cut the substrate inside the paddings, which allows a lot of variations of application. Measure the length from behind the elbow, coming up both sides of arms to the MCP joint. Select the appropriate size of splint and cut the desired length of the splint. Open the splint and put on the substrate. Fold it in half and round the edges slightly diagonal with scissors. Cut slightly diagonal across the splint and round the edges as well. Put both splints on the padding. Be sure that 2 cut splints make triangle in the middle of the splint and close the padding. Cut the padding in the middle, following the triangle shape of the substrate inside the padding. Make sure not to cut the padding completely and leave 1 centimeter width of the padding. Dip the splint in the water and squeeze out the excess water. You may use a towel when squeezing out the splint if you may concern the moisture. Place the splint on the patient's arm by hanging the cut area over the fingers between the thumb and index finger. Align the splint with the wrist and arm. Wrap the arm and splint with any kind of bandage. Begin with the wrist and go to the web space. For an ideal immobilization, repeat this step again. Proceed to overlap 50% the bandage toward to the elbow. Fold the one side of excess splint under the elbow and secure it with the bandage. And fold the other side of splint under the elbow. Keep wrapping around the elbow and tape it. Make sure that the elbow should be in position of 90 degrees. Mold the splint with the palm of your hands. Hold the patient's hand in an arm wrestling position and finish the molding. Make sure that the patient's hand has enough mobility to make a fist without any discomfort after application. And now you are done with Reverse Sugar Tong Splint.